Hello, everyone. So, for today, we will be continuing with your peripheral vascular system. What are some of the things that you need to assess? Okay, for your peripheral vascular system, check for coldness, any numbness that your patient might feel, tingling, any swelling of their legs, or any edema. Any discoloration in their hands or feet could be cyanotic, wherein it would turn bluish in color, or pallor, they would turn pale. Any varicose veins or other complications, thrombophlebitis, wherein that's the inflammation of a vein. It's usually associated with your blood clots. Okay, but usually when it comes to thrombophlebitis, it usually involves the superficial vein, so it's less dangerous. But then again, your thrombophlebitis could progress to your DVT or your deep vein thrombosis. Okay. So health promotion for this, okay, remind our patients or our clients, does the work that they have involve long-term sitting or standing? Okay. If so, they should elevate it by the time that they are at rest. Okay. Kailangan i-elevate po nila yung kanilang legs para mawala yung edema. So they should also avoid crossing the legs at the knees and wear support hose. For the urinary system, so, do they have any urinary frequency wherein ihi sila ng ihi, urgency, nocturia? So, it's the same, but when it comes to nocturia, it usually happens at night. So, they usually wake up at night to urinate. Okay, pag sinabi naman natin dysuria, okay, that's painful or burning urination. Masakit po pag umiihi sila. So, that's most common in UTI. Okay, but then again, it's also associated with kidney stones. Okay, your polyuria, madami, okay, excessive, okay, excessive urine output. So usually, more than 3 liters in a day for adults. Madalas pwede niyong makita sa may mga DM or your diabetes mellitus or even in diabetes insipidus. Okay, for oliguria, that's the opposite of your polyuria, decreased urine output naman. So usually less than 400 ml a day. It could usually happen with patients who have problem with their kidneys, meaning yung may mga kidney injury. Or pwede rin pag may dehydration, pwede rin pag nag-undergo ng shock. Ayan. Or pag may urinary obstruction kay patient. Okay? Incontinence, history of urinary diseases, pain in the flank, and suprapubic region in the low back. Yan. So measure to avoid or treat urinary tract infections, use of your Kegels, exercise. And syempre then, pag-take ng water, ayan, proper hydration for your abdomen. Okay, so when you assess your patient, okay, ask the patient to void first kasi syempre pag ipapalpate nyo yan, ipipress down ninyo, 'di ba? So there's a possibility na baka mamaya si patient maihi po siya lalo kung full yung kanyang abdomen. Okay? So you place the patient in a supine position. Kailangan yung arm nila nasa sides and bend the knees slightly. So you'll be exposing their abdomen para makita ninyo kasi magsisimula tayo sa inspection. Okay? So the nurse's hand and the diaphragm must also be warm. Kailangan medyo mainit yung kamay natin para naman hindi magulat si pasyente pag ang lamig-lamig. Okay? So the sequence of techniques when performing your physical exam for the abdomen is inspection, auscultation, percussion, then palpation. Bakit sa case na to, nauuna si auscultation? Di ba usually huli ang auscultation ninyo? So usually, it's because when you touch the abdomen, it can change the bowel sounds, di ba? Usually kasi after inspection, ang sumusunod is percussion, di ba? Okay, percussion, palpation, gano'n. So in this case, mauuna po si auscultation kasi there's a possibility na mag-change yung vowel sounds. Okay? So, magkakaroon na ng problema dun sa accuracy nung ano ninyo, nung inspection ninyo, yung auscultation ninyo, percussion, and palpation. Basically, your physical examination. Okay? So, sequence was the sequence from right lower quadrant to right upper quadrant, tapos left lower quadrant and left upper quadrant. So, these are some of the organs that you could find in these quadrants. Ayan, you have your liver, your gallbladder, head of your pancreas, right kidney and adrenals, hepatic flexure of your colon, part of your ascending and transverse colon in your right upper quadrant. Okay? For your left upper quadrant, you have your stomach, your spleen, the left lobe of your liver, body of your pancreas and tail, left kidney and adrenals, the splenic flexure of your colon, and part of the transverse and descending colon. Next is your right lower quadrant. You have your cecum, your appendix, right ovary and fallopian tube, right ureter, spermatic cord, the ascending colon, and the right kidney. For your left lower, meron kayo dyan yung descending colon ninyo, yung sigmoid colon. For the females or the ladies, you have your left ovary and fallopian tube, the left ureter, and the left spermatic cord. Okay? For the midline, you have your aorta and uterus if it is enlarged, and the bladder if it is enlarged. For inspection, observe the contour of the abdomen. Stand on the patient's right side and look down to the abdomen. Okay, the nurse's head should be slightly higher than the patient's abdomen, and the contour describes the nutritional state of your patient. So normally, it should be flat to rounded. Abnormal po siya pag scaphoid or concave yung shape, or if it's protuberant or nagdi-distend. Okay? So check your umbilicus for contour or any hernia. So normally, dapat it should be in midline and inverted. No any signs of discoloration for your umbilicus, no inflammation, no hernia. So it usually becomes everted and pushed upward if there is pregnancy or if your patient is pregnant. Okay? Aside from that, hindi po normal na merong ganun si patient. So, another thing, it can occur, pwedeng everted siya. Okay, aside from pregnancy, pwedeng everted siya pag may ascites si pasyente. Ascites or presence of abdominal mass. Okay, another abnormality can be deeply sunken with obesity, enlarged and inverted pag may umbilical hernia. Okay? So when you say ascites or ascites, that's the abnormal accumulation of fluid saan? Sa peritoneal cavity, which can cause abdominal distension. Okay? So, bluish periumbilical color occurs with intra-abdominal bleeding or your Cullen sign na tinatawag natin. Okay? So, for your umbilical hernia, I don't know if you've seen that already. Okay. So, that usually happens when part of your intestine or the abdominal tissue protrude through a certain weak spot in your abdominal wall, particularly sa umbilicus ninyo. Okay, dyan sa may bandang pusod. So, it usually appears as a soft bulge near your belly button. Okay, pero yan, medyo common siya sa babies. Pero usually, nag-close on its own by age 3 to 5, ganun. Okay, Cullen sign, again, bluish discoloration also. Okay, parang ecchymosis siya around the umbilicus or dun sa may bandang pusod. Okay, it can indicate na merong intra-abdominal bleeding. Madalas late sign na po yan. Late and a serious sign. Okay, it's usually associated with your acute hemorrhagic pancreatitis. Pwede rin siya mangyari pag may ruptured ectopic pregnancy or abdominal trauma, or pwede pag may ruptured abdominal aortic aneurysm yan. Okay, it's possible that it could happen. So, observe the skin characteristics of your abdomen. The skin surface over the abdomen should be smooth and even with homogeneous color. Common pigment change is striae or your linea albicans. That's a silvery white linear jagged marks about 1 to 6 centimeter long. Okay, so yung mga stretch marks, ayan, that's your striae or your linea albicans. Okay, so that's caused by the rapid stretching of your skin. So usually when they are new, bago pa lang, they're called your striae rubra. Okay, so usually when they're old and healed, they are called your linea albicans. Ayan, usually pag may rapid weight gain, ayan, pregnancy, obesity, mga ganyan, they're related to that. No lesions should be present and your patient should have good skin turgor. Abnormalities, okay? Redness with localized inflammation, jaundice, lesions, rashes, and any abnormal na napag-aralan na natin. Skin glistening with thought with ascites or ascites. Stria also occur in ascites, pwede rin. Unusual color or change in the shape of mole may indicate CA or cancer ninyo. 'Di ba pag biglang lumaki yung isang nunal, nagbago yung shape, etc. It can indicate cancer. Petechiae, that also may indicate you're bleeding. Okay, there's a possibility. Yung mga petechiae, kung naalala nyo pa, yung mga parang tiny pinpoint, reddish, purplish spots. Okay, usually that can happen because of your capillary bleeding. Okay. So, poor skin turgor occur with dehydration. So, note for pulsation or visible peristalsis and movement. For your lower extremities, while in supine position, expose the legs, keep the genitalia covered. Syempre, takpan ninyo. Okay, privacy din naman ng patient. Inspect both legs together. Note the skin color, hair distribution, venous return, size. Okay, kung may swelling ba or muscle atrophy, and any skin lesions or ulcers. Measure the cuff circumference with tape measure if lower legs appear asymmetric or unequal in size. Normally, hair should cover the legs, okay? Pero syempre hindi naman po lahat meron. Okay, the venous pattern in the legs is normally flat and barely visible. And you can also note any obvious varicosities. Okay, both of your legs should be symmetric in size, walang swelling, walang atrophy. Abnormal pag yung skin sa legs, it can appear pale with vasoconstriction. Reddish naman pag vasodilation. Cyanotic pag poor yung oxygenation niya. Thin skin, and pag may with pallor and coolness. Loss of hair, may ulcers, may gangrene sa legs, it can indicate arterial insufficiency. Bilateral edema in the legs of your patient. Okay, when we say bilateral edema, that means swelling in both of the lower extremities. Usually, pag sinabi natin ganyan, mayroong excess fluid accumulation. Okay? So, pag sinabi natin bilateral, it can usually suggest systemic yung cause, hindi po local. Okay? Very common pag may heart failure, kidney diseases, liver diseases, pwede rin sa mga medications. Ayan. So, it can indicate systemic illnesses affecting the heart or kidneys. Okay? Acute unilateral painful swelling in the legs may also indicate your DVT or your deep vein thrombosis. Okay? Pag sinabi natin DVT, okay, that's the formation of blood clot. Saan po? Sa deep veins. Andun na yung ano natin. Usually, in the legs, the calf or the thigh, pwede rin. So, this one can be life-threatening if the clot can dislodge. Okay, ikot yan sa buong system ninyo. Okay? The patient might have pulmonary embolism pag ganun. Okay? And that is the end for your coverage for your midterms. Okay? So, start reviewing and I'll see you all soon. If you have any questions, you can place them in through comments or maybe in our GC. Okay, so thank you for listening.